Hi, it's nice to meet you. I'm Dr. Asmer, and I will be doing your exam for your newly adopted puppy today. Oh my goodness, he's so cute. So cute. What's his name? Oh, Blue. Hi, Blue. Oh my goodness. So adorable. Where did you get Blue? Oh, I always appreciate people who adopt. And what shelter did you get him at? Oh, they do extraordinary work for animals. Definitely a worthy place and a worthwhile charity to contribute to when people can. I donate my time there also. Wonderful. You're wondering what breed he is. You know, he definitely does look mixed for sure, but based on the features and the consistency of his coat and length of his snout, I'd say definitely a lab mix. Definitely. Well, anyway, shall we go ahead and proceed with the exam? Okay. Well, first what I'm going to do is I'm going to go ahead and take his heart rate. Just give me a second here. Wonderful. Perfect. Now, let's see if we could get him to stay still. Okay, well, this is not the most fun part for puppies and kitties and pretty much anyone that's an animal that comes in here, but we've got to do the temperature. So let me go ahead and do that. Just get it in here and hold it for a second. Okay, great. 100.5, which is great. We're looking for it to be between 100.5 and 102.5, so we're right at a healthy level. Let's get a look at his eyes. They look clear. This is good. Nose looks good. Definitely very wet. Oh goodness. Okay, let's look at his teeth. Okay, I'd say based on his teeth, he's definitely about 9 months old. Looking at his teeth and his paws. Okay, I'm going to go ahead and palpate his abdomen, just make sure everything feels okay. Looking good, wonderful. Okay, well, as you know, another part of this exam that's very important is to go ahead and take care of his vaccines today. Now, one of the most important, of course, is the rabies vaccine. Rabies is a very serious disease. It's a viral disease that basically is highly contagious if they do not have the vaccine for this, and unfortunately in dogs the disease is always fatal, so and that is also a requirement that he gets that done. So we'll go ahead and take care of the rabies today. And the other one we're going to want to take care of today is the canine distemper. And distemper is also a viral disease of dogs, and basically it's inevitable that they will be exposed to this virus, so it's highly recommended that we get that done, and that's also a requirement in this county, so go ahead and take care of that. And obviously, him being a puppy, he is at the greatest risk, so we'll go ahead and take care of the distemper. And we're going to want to do a vaccine for canine parvovirus. Parvo is a very deadly and painful disease that can afflict puppies, so we'll want to do that. And the last one would be the Bordetella. And Bordetella is also a very serious virus that puppies can, and dogs can, unfortunately get. So we're going to definitely do that one. That's another requirement for the county. And the one that's optional, that I may suggest to you, is the the vaccination for canine parainfluenza. And it's this newly emerging disease caused by the flu virus in dogs. And this virus strain is known as H3N8, and it unfortunately causes a respiratory illness. And it's highly contagious. And it's rather difficult to treat once once it presents symptoms. And your dog coming from a shelter and rescue organization, fortunately they are more susceptible, along with if you do plan on kenneling him at some time, if you go on vacation. So I'd recommend doing the canine influenza vaccine. Okay, you definitely want to do that too. Okay, we will go ahead and do that. So at this point, I think it's pretty good. We don't want to overload his system too much. So we'll go ahead and do those for you. Okay, let me go ahead and get the syringes for that. If you could hold them steady. Just opening these up. They're of course sealed, but they are perfectly sterile. Okay, let's go ahead and do this. I know. Okay, there's the rabies. Okay. There's the parvo. The influenza. And Bordetella. Okay, this one is probably the most least fun. We got to go ahead and do a quick squirt right in the nose. Okay, here we go. If you could kind of help me hold his head. Thanks. Shh. Oh, I know. They always sneeze. Thank you. Okay. But sure, he's all done. Fabulous. Okay, now at the place that you adopted him, did he now was he, well, I can feel actually that he was not neutered. Okay, because some do and some don't, but obviously I'm recalling from my examination he's definitely not neutered. So that's something you probably would want to schedule. I imagine that you don't plan on breeding him, and it's also not really recommended to do that. And in this county, if you don't have a pet fancier's license, your dog is required to be spayed or neutered, of course in Blue's case neutered. So basically well, we have two ways of doing it these days. What we have now is like a laparoscopic surgery, where it's kind of the use of lasers. It makes the actual procedure shorter, and it also shortens the amount of recovery time, and that's something I do recommend if you're agreeable to that. Otherwise, it's the traditional route, which will require more days of healing and more supervision. of him. Okay, you want to look into scheduling the laparoscopic surgery. Okay. And you're wondering about, okay, any kind of follow-up things that you'll have to worry about on doing that. Basically they'll be very groggy from the anesthesia, and he may not be that very interested in eating or drinking for up to 24 hours after the procedure. And we'll give you a full care guide after his procedure, but he can't exercise, he can't run around. I know he's a puppy, so that's hard, but gotta keep him still. There won't be any kind of sutures or drains or anything that you would have to worry about. But worst case scenarios where you would need to contact us after the procedure would be if his appetite loss is longer than 2 days, not wanting to drink for longer than 1 day, any kind of obvious signs of like a depression, an elevated or subnormal temperature, diarrhea, vomiting more than once, and excessive pain and discomfort, and protracted coughing. And what we would also be sending home with you, just so that you're aware for your for budgeting, is we'd also be sending home some tramadol with him to help with the pain. Just a small amount of that medication just to help him out. But you can definitely talk to Sally up front to go ahead and schedule his neutering. It's kind of best to get it done as soon as possible. Let me go ahead and hand you your rabies chip and your paperwork. Okay, well, thank you so much for coming in today, and I look forward to seeing Blue again soon when we do his surgery. Thanks a lot. You guys have a great day. Bye.